All right, welcome back to the deep dive, where we unpack research so you don't have to.
That's right.
Today, we are taking a deep dive into FIV in domestic cats, Feline Immunodeficiency virus.
Yeah. FIV, everyone's heard of it, but
Right.
we're going to get into some really interesting stuff.
Yeah, we got a whole stack of recent studies here, mainly from Australia, with a few from Europe as well. And we're going to extract the most important nuggets
Yes.
for you. So we'll be looking at how common FIV is, what it means for a cat's health,
Right.
the best ways to test for it, especially when vaccination is involved.
That's a tricky one.
It is. And even some surprising social connections
Right.
that we found in the research.
We want a really clear, insightful understanding
Yeah.
of what the latest science tells us about FIV. Forget the basic textbook stuff. We're getting into the
real nitty-gritty there.
details. Yeah.
Yeah.
All right, so let's start with prevalence and risk factors.
Yeah.
We know FIV is a global virus.
But the research really shines a light on Australia. It seems to be way more common there
Yeah.
than in many other parts of the world. Why is that?
It's fascinating because it's likely a combination of things specific to Australia.
Yeah.
The studies point to the widespread practice of letting pet cats roam outdoors.
Okay.
So more outdoor time means more chances for encounters
Right.
and, unfortunately, more chances for fights.
Yep.
Australia also has these significant populations of feral cats.
Yeah.
And these can act as a reservoir
Mm-hmm.
for the virus.
Yep.
So the key insight isn't just that. Australia has more FIV, but that outdoor access and feral cat populations are likely major drivers globally.
I see. So those fights that you mentioned,
Yeah.
that's the primary way FIV is transmitted, right?
Yeah.
Through those bites and saliva.
The research consistently shows that the main route of transmission is through the exchange of saliva, usually through those deep bite wounds,
Yeah.
that happen during cat altercations.
Right. Makes sense.
And this really explains why we see a higher prevalence in male cats,
Okay.
particularly those who haven't been neutered. The tomcats,
Right.
their territorial nature
Makes sense.
leads to more of these aggressive interactions, the more free roaming unneutered males
Yeah.
in an area, the higher the FIV prevalence tends to be.
So getting your male cat neutered does more than just help with unwanted litters.
Absolutely.
It's a significant factor in preventing FIV from spreading.
In the community, yeah.
In the community.
Yeah.
Are there any other ways a cat might get FIV,
Yeah, there are
even if they're less common?
a few less frequent possibilities.
Yeah.
One was what we call iatrogenic transmission,
I see.
which is essentially the spread of disease through medical procedures.
Right.
This could happen, for example, through contaminated surgical equipment or even blood transfusions.
Okay.
There's also the potential for a mother cat to transmit FIV to her kittens, either while they're in the womb
Okay.
or perhaps through infected milk,
Well,
or even during birth. However, the Australian research suggests that in their situation, these routes
yeah.
seem to be less significant
Okay.
than those bite wounds.
Now, this is where it gets really interesting. Some of the Australian research has found a link between how common FIV is
Yes.
and the socioeconomic status of the area where the cats live.
It's fascinating, isn't it?
Yeah. Can you tell us more about that?
This is a really important piece of the puzzle.
Yeah.
Researchers used several of Australia's socioeconomic indexes for areas or SEFA.
Yeah.
Essentially, these are different ways the Australian government measures how disadvantaged or advantaged a particular area is, looking at things like income, education, employment. What they found was that several of these indexes,
Okay.
the index of relative socioeconomic advantage and disadvantage, the index of relative socioeconomic disadvantage, and the index of education and occupation were significantly lower for cats that were infected with FIV.
So cats in more disadvantaged areas.
Yeah, we're talking about scores being 20 to 29% lower.
Yeah.
This strongly suggests that cats living in socioeconomically disadvantaged areas
Right.
are more likely to have FIV.
Yeah.
They even identified geographic hotspots in northern and western Melbourne.
Oh, that's really interesting.
The starkest insight here is that FIV isn't just a biological issue.
Right.
It's deeply intertwined with social determinants.
That's a huge difference, 20 to 29%.
Yeah.
But I noticed that the index of economic resources didn't show the same strong connection.
And that's a crucial distinction.
What does that tell us?
The fact that the index of economic resources didn't correlate as strongly suggests that simply a lack of money might not be the main driver here. Instead, the researchers propose that a lack of education and awareness about how FIV is spread and how to prevent it could be a more significant factor in these areas. This really highlights how vital it is for vets and animal welfare organizations to focus on clear and accessible education for cat owners.
So it's not just about whether people can afford care, but also whether they have the information they need
to protect their cats in the first place.
Now, to give us a broader picture, what's the situation like in other parts of the world? You mentioned some European studies earlier.
The European data shows us that FIV prevalence can really vary quite a bit from one region to another. For example, surveys in South Italy have reported FIV in anywhere from about 7.6% to as high as 37% of cats.
Wow, that's a big range.
Huge range. Spain also shows a wide range from around 5.1% to 20.9%.
Okay.
This variability underscores that. Local factors like the density of cat populations, how many cats roam freely, and even local climate can all play a role in how common FIV is in a specific area.
All right, so we have a good understanding of how FIV spreads and where it seems to be more common. Let's talk about what it actually does to cats. The clinical signs and the impact on their health. FIV is often compared to HIV in humans. How accurate is that comparison?
It's a helpful starting point because like HIV, FIV is a lentivirus. Think of a lentivirus like a slow-moving virus that takes its time to affect the body, unlike a common cold that hits you quickly. And both viruses target the immune system. However, and this is really important, cats and FIV have been co-evolving for a very long time. Potentially tens and thousands of years. Compared to just over a century for HIV in humans. This much longer history suggests that FIV has likely become less virulent or less harmful to cats over time.
So while it does affect their immune system, the consequences might be different than what we typically think of with HIV.
FIV does cause immunosuppression. By reducing the number of CD4 plus T cells. Think of these cells as the generals of the immune system. They're crucial for coordinating. The body's defense against infections, FIV, also leads to a reduced ratio of CD4 plus stay to CD8 plus T cells and can disrupt the production of signaling molecules called cytokines. Well, FIV positive cats can be more vulnerable to secondary infections. The really severe, life-threatening, opportunistic infections we see in the advanced stages of untreated HIV are quite rare in cats with FIV.
That's good.
Many FIV-infected cats can actually remain healthy for many years, even with lower count of those CD4 plus cells.
That's definitely reassuring to hear. So what are some of the more common health issues or clinical signs that a vet might notice in a cat with FIV?
The studies often mentioned enlarged lymph nodes, which we call lymphadenomegaly. It's a common finding. Skin problems and oral issues. Like gingivitis and stomatitis. That's inflammation of the gums and mouth. Are also frequently observed. This can often be a direct result of FIV weakening the immune system. Making the cat more susceptible to these kinds of problems.
And are there any other specific health conditions that seem to be linked with FIV infection in cats?
Yes, research has shown. A connection between FIV infection and a higher occurrence of feline odontoclastic resorptive lesions, or FORL, which are painful dental issues where the teeth start to break down. There's also a potential link with certain types of cancer, such as lymphoma and cutaneous neoplasms, which are cancers of the skin. However, it's important to remember that just because two things occur together doesn't automatically mean one causes the other. More research is always ongoing to understand these connections better.
Now let's talk about what blood work might reveal in a cat with FIV. Are there typical changes that vets look for?
Yes, the blood work can show a few different things. Lower levels of red blood cells, erythrocytes, and hemoglobin. The protein in red blood cells that carries oxygen have been seen in cats with FIV. This could be even more noticeable in cats who also have the co-infection with leishmania, which we'll discuss later. Interestingly, if a cat just has leishmania, they tend to have moderately low red blood cell counts, while cats with only FIV are more likely to have severely low counts. FIV infection on its own. It's also often associated with what we call an inflammatory leukogram, meaning an increase in neutrophils, which are a type of white blood cell, as well as an increase in monocytes. Another type of white blood cell, an elevated platelet count, or thrombocytosis.
Thrombocytosis
has been linked to cats.
Yeah.
Who have both leishmania and FIV.
Okay. So that sounds like a pretty complex picture in their blood.
It is.
Does the stage of the FIV infection make a difference in these blood changes?
Absolutely. In the early, often symptom-free stages of FIV, it's common to see that increase in neutrophils and monocytes. And these cats usually still have a normal blood response.
Yeah.
If they get another illness at the same time, however, as the infection progresses. To more advanced stages, we're more likely to see cytopenia, which means a decrease in various types of blood cells. This can include anemia, low red blood cells, leukopenia, low white blood cells overall, neutropenia, low neutrophils specifically, and lymphopenia, low lymphocytes, another type of white blood cell.
All right, looking on to how we actually diagnose FIV. Point-of-care antibody tests are usually the first step, right?
That's correct. These quick in-clinic tests that look for FIV antibodies in a cat's blood are a convenient initial way to check.
But the research really emphasizes that. If one of these tests comes back positive, especially in a shelter setting, there's another crucial step.
Definitely.
What is it and why is it so important?
Confirmatory testing is absolutely vital, particularly in places like animal shelters, where a positive FIV test, unfortunately, could lead to a decision about whether to euthanize a cat, because no test is perfect, and false positives can happen, a positive result from MART. One of these initial point-of-care tests should always be followed up with a different, more specific test to be sure of the diagnosis.
Now, the development of the FIV vaccine definitely made diagnosing FIV more complicated for a while. Can you explain why that was the case?
Originally. The problem with the FIV vaccine was that the standard antibody tests couldn't tell the difference between the antibodies a cat produced in response to the vaccine and the antibodies they would produce if they were actually infected with the virus. So a cat that had been vaccinated would test positive, even if they didn't have FIV. This obviously caused a lot of confusion for vets and owners.
But thankfully, we've made progress with that.
We have.
Haven't we? We now have these DVIA tests.
Yes.
What does DVIA stand for?
It stands for differentiating infected from vaccinated animals.
Okay. And how do they help us tell the difference?
These newer rapid test kits, like Witness and Antigen Rapid, are designed to specifically detect antibodies that are produced when a cat is actually fighting off an FIV infection, but not the antibodies that just result from the vaccination.
I see.
So generally a cat that has been vaccinated but is not infected with FIV will test negative on these DVIA tests.
Okay, so they're kind of clever.
They are.
Because they look for
They look for a specific type of antibody your cat only makes if they've actually fought off the virus, not just the ones their body produces after vaccination.
That's a really significant advancement.
It is.
The research highlights that. One DVIA test in particular, the Rapid Status 5 test, has shown very high accuracy in Australia.
Yes. The Rapid Status test has had very promising results in Australian studies. Supported accuracy, ranging from 98.8% to 100%.
Wow.
This really establishes it as a reliable tool for diagnosing FIV in that region, even in vaccinated cats.
Are there any situations where even these DVIA tests might give us a misleading result?
There is one important thing to keep in mind in very young kittens, particularly those under 6 months old, who've recently had their initial series of FIV vaccinations. There's a possibility of getting a false positive result on a DVIA test, like these specific cases. A different type of test called PCR, which looks for the virus's genetic material rather than antibodies, is recommended, to confirm whether the kitten is truly infected. However, in cats who have had their annual booster vaccinations, DVIA tests are generally considered reliable.
And what about PCR testing in general? When is that the best approach for diagnosing FIV?
PCR testing has the benefit of being able to determine if a cat has FIV, regardless of whether they've been vaccinated or not, however. It tends to be more expensive and takes longer to get the results back compared to the rapid antibody test, which makes it less practical for quick screening, especially in a busy shelter environment. It's also worth noting that PCR can sometimes be less sensitive than antibody tests. Meaning if a cat has a very early infection and hasn't developed a high viral load yet, the PCR test might come back negative, even if they are infected.
I see.
So a negative PCR doesn't completely rule out infection. especially in the very early stages.
One last interesting point on testing, saliva testing. One of the studies mentioned antigen rapid test showing promise as a less invasive option.
Yes. The antigen rapid kit has been investigated as a potentially less stressful way to test for FIV in some situations, while blood testing is still considered. The most reliable method, saliva testing, could be particularly useful in kittens or in shelter environment, where drawing blood might be more challenging, might require specialized skills.
Isn't it much easier to swab a cat's mouth?
Cats might not love having their mouth swabbed.
Yeah.
But it's often less stressful for them than getting a needle.
Yeah, for sure. All right, let's switch gears and talk about managing and preventing FIV.
Okay.
The research makes a point of saying we should avoid using the term feline AIDS. Why is that so important?
It's outdated and really creates a lot of unnecessary fear.
Right.
And misunderstanding, as we discussed earlier. Because cats and FIV have coexisted for so long, FIV infection in cats
usually doesn't progress to
the severe and rapid immune deficiency that we see in untreated HIV in humans.
Okay.
Most FIV-infected cats can actually live long.
Yeah.
Healthy and happy lives with proper care.
So, if a cat is diagnosed with FIV, what are the key things their owners should focus on for their management?
The main focus needs to be on keeping them as healthy as possible overall.
Right.
This includes providing good nutrition, a low-stress indoor environment, and paying close attention to hygiene, early detection, and prompt treatment of any other illnesses that might come up are also crucial.
Yeah.
Owners of FIV-positive cats need to be observant and shouldn't hesitate to take their cat to the vet at the first sign of any health issues.
And when it comes to preventing FIV in the first place, what's the #1 recommendation?
Keeping cats indoors is absolutely the most important thing you can do to prevent FIV.
Okay.
This dramatically reduces their risk of getting to fights and sustaining bite wounds.
Right.
Which, as we know, is the primary way the virus is transmitted, even in households with multiple cats.
Yeah.
If the group is stable and kept indoors, the risk of FIV transmission is quite low.
What about if you have a multi-cat household and one of the cats is diagnosed with FIV? Should you test the others?
Yeah.
And do you need to keep them separate?
Testing the other cats in the household.
Yeah.
It's definitely a good idea.
Yeah.
In that situation, whether you need to separate the FIV-positive cat from the others really depends on the individual cat's personalities and whether there's a history of aggression and fighting among them and stable, non-aggressive indoor groups. Separating them might not be necessary as the risk of transmission through casual contact is minimal.
And for animal shelters, what are the recommended best practices when it comes to FIV-positive cats? For
adult cats in shelters, individual housing is generally recommended to minimize any risk of fighting. If they do have group housing, it's essential that. The FIV status of all the cats in the group is known, most importantly. Euthanizing healthy cats simply because they test positive for FIV is not considered an ethical practice.
Yeah.
These cats can often be adopted into loving homes and live full lives.
Let's talk about the FIV vaccine again. Fellovax FIV. What does the current research tell us about its role in preventing infection?
The Fellovax FIV vaccine is considered a non-core vaccine by most veterinary organizations, meaning it's not routinely recommended. For every cat, studies on how well it protects against infection has shown varying results. Yeah. And it's definitely not effective. In cats that are already infected,
I see.
It might be considered for cats who are at a higher risk of being bitten.
Okay.
For example, those who go outdoors frequently.
Right.
Despite their owner's best efforts to keep them. It's crucial to test a cat for FIV before vaccinating to make sure they aren't already infected. And because the vaccine isn't 100% effective, annual testing is also recommended for cats that have been vaccinated.
And finally, are there any antiviral treatments that are typically recommended for most cats with FIV?
Not as a routine treatment, while some antiviral medications like zitavudine or AZT have shown some promise in treating specific problems that can be associated with FIV, such as neurological issues or severe inflammation of the mouth stomatitis. They can also have side effects and limitations, generally speaking.
Yeah.
Using antiviral drugs to treat FIV in cats is still considered experimental.
Expert speaker.